Hi, I'm Dr. Corey. I'd like to take this opportunity to discuss with you ways to promote healing to minimize the symptoms that always occur following a surgical procedure. Following surgery, one has to expect there to be some initial bleeding, swelling that occurs over a few days, pain and discomfort that should steadily decrease with time, and some initial stiffness of your jaw. Occasionally, infection or other complications can accompany surgery. Let's discuss ways to minimize these symptoms. There is always some initial bleeding following surgery. Dissolvable stitches will have been placed to help you heal and to lessen your bleeding. These stitches will fall out on their own between 5 and 14 days, depending upon your procedure. Do not vigorously rinse, spit, or suck on things such as a cigarette or a straw. These activities would further stimulate bleeding. There should be no smoking or vaping for at least 1 week following surgery. Bleeding can best be controlled by the application of firm, steady pressure directly on the wound. A gauze pressure pack will have been placed directly on the surgical site when you leave the office. Bite firmly on this gauze for 30 minutes. Extra gauze will be given to you for changes of the pack at home. Do not eat or sleep with the gauze pack in your mouth. Fold the gauze into a square and place it directly onto the surgical site. It is important that the pack is placed directly on the socket or the wound itself and not just between the teeth. Change the gauze packs every 30 to 45 minutes until bleeding is controlled. It's normal to have slight oozing and the taste of blood in the mouth for the first 24 hours. If the bleeding seems excessive or prolonged, wet a tea bag, wrap it in gauze, and bite firmly on this for 45 minutes. If this does not lessen the bleeding, call the office. Occasionally, some patients will develop bruising or skin discoloration following the surgery. This condition is temporary. The discoloration is due to some blood that accumulates in the tissue, and it normally takes 2 to 4 days for this to reach the skin surface. If you do get some bruising, apply warm compresses to the area. The discoloration will fade at a faster pace. Swelling is a normal consequence of surgery. Expect swelling to increase over the first few days, reaching its maximum on the second or third morning following surgery. Swelling will then take 2 to 3 days to resolve. Swelling can be minimized with the regular application of ice packs to the side of the face, 30 minutes on, 30 minutes off for the first 24 hours. Keeping the head elevated will also help in lessening the swelling. If the swelling does not lessen within 5 days, notify the office. Some pain is to be expected following surgery. The pain is most intense on the day of the surgery and will lessen each day thereafter. Mouth pain is the result of inflammation. The most effective pain reliever is an anti-inflammatory, such as ibuprofen, better known as Advil. Provided that you have no allergies or medical conditions that would prevent you from using these medications, take 600 milligrams of Advil along with 325 milligrams of Tylenol. That is 3 Advil and 1 regular strength Tylenol every 8 hours to control pain. These 4 pills should be taken at the same time. This Advil-Tylenol combination has been shown to be more effective than narcotics at relieving oral surgical pain. If this combination has failed to make your pain manageable within 30 to 45 minutes, a prescription pain reliever can be taken in addition as directed. If used as directed on the first day or 2 following surgery, the Advil and ice packs will lessen the jaw stiffness that also accompanies oral surgery. If the pain worsens at any time after 3 days, it's important that you notify the office. If antibiotics were prescribed, take them as directed. Tell your dentist if you are on birth control pills before you start taking an antibiotic. Consider taking probiotics when on an antibiotic to help keep your digestion regular. Medication should not be taken on an empty stomach. It is important to eat and drink following surgery. Everything that you eat or drink on the first day should be cool or cold. Warm foods and drinks on the day of surgery will increase the bleeding, swelling, and the stiffness of your jaw. Warm foods can be started 24 hours following the procedure. Stick to soft, non-acidic foods and drinks for the first 3 days after surgery. A firmer diet can be started thereafter as tolerated. It is normal to have stiffness of your jaw with limited mouth opening following surgery. This tightness should steadily decrease over the course of a week. If jaw stiffness persists beyond a week, call our office. It is important to keep your mouth clean on the days following surgery. Starting the day after the surgery, gently rinse your mouth with warm salt water a half dozen times during the day, especially after you eat. Mouthwash can be used in addition to warm salt water if you desire. Do not rinse with hydrogen peroxide. Brush and floss your teeth starting the day after surgery. Stay off the teeth immediately adjacent to the surgical site for the first 3 days. Due to swelling and limited opening of your mouth, a baby's toothbrush may be easier to use in cleansing your teeth. If you had bottom wisdom teeth removed, an irrigation syringe will be given to you. Start to use this syringe to wash food out of the sockets 1 week following the surgery. Fill the syringe with warm water. Place the curved tip of the syringe behind the last tooth and gently squirt the water into the socket. Do this after every meal and before bedtime. It usually takes 2 to 3 months for these sockets to close. It is not unusual to have a low-grade fever the day of the surgery. If your fever is over 101 degrees, or if it persists beyond 24 hours, call the office. It is important to refrain from heavy physical activities or heavy lifting for 3 days following the surgery. Avoid contact sports for 1 week. Light exercise can be done as tolerated. You will have received a local anesthetic such as Novocaine for your surgery. This will cause a temporary lack of feeling in your lips or tongue. Do not chew foods or bite on your lips or tongue while you are numb, because this may cause trauma to the tissues. Call the office if the feeling of numbness has not worn off by the morning after surgery. Occasionally, the upper tooth roots will involve the sinus floor. This is especially common if there is an infection at the root tips. If your doctor has told you that the sinus was affected by the surgery, it is important that you do not create a pressure difference between the mouth and the nose. This means do not suck on anything for 10 days, such as a cigarette or a straw. Do not blow your nose for 10 days. If you must sneeze, try to sneeze through both your mouth and your nose at the same time. Following these instructions will help you in the days following surgery and keep you more comfortable and promote healing. If you have questions or concerns, do not hesitate to call our office. Again, thank you for choosing our office for your oral surgical needs.